Bonjour, hello. My name is Julie Payette, and I am the Governor General of Canada. I have the honor of addressing you as part of the INGSA dialogue on science advice and COVID-19 before you proceed with the panels and roundtables on the program. I would like to thank Sir Peter Gluckman, Chairman of INGSA, and Dr. Rémi Quirillon, Chief Scientist of Quebec, for giving me this opportunity. My connection to INGSA before the SARS coronavirus 2 engulfed the planet was that its fourth international conference was to take place in Montreal, my hometown. But I believe I've been asked to speak to you briefly today, perhaps for two other reasons. One is that, like many of you, I have spent most of my professional life advocating for the use of facts, data, and scientific evidence to help inform decision-making. And two, I am an astronaut who has had the extraordinary privilege of seeing the Earth from above. I flew twice in space, on board the Space Shuttle and on board the International Space Station. And on both missions, I was struck by the beauty of our planet and by its uniqueness. When you fly a spaceship 400 kilometers above the surface of the Earth, you see the world from a different perspective. And you can't help but realize that we, the 7.8 billion human beings and the countless species that inhabit this world, share a common home, and that there is currently only one place where we can live. From orbit, we realize how everything on the planet is connected in some ways, and that nature, weather, ecosystems, and viruses know no borders. And how inescapable it is that we must share knowledge and work together in order to find solutions to global scale issues that impact us all. Some say that this pandemic has brought a new appreciation that science can help change lives, improve lives, save lives. The benefits are unequivocal and recognized by most. But the rapid pace of advances in science and technology and the proliferation of information sources, although giving people greater freedom to make their own choices, also carry risks. Because no matter how thorough and vigilant we are in this day and age, there is always some uncertainty that lingers and false information that spreads. It then becomes more vital than ever that policymakers be in a position to evaluate new developments, provide reliable and accurate information, and to diminish the risks by establishing norms and standards and by taking necessary mitigating measures. I believe science advice and science diplomacy are at the heart of ensuring successful policies in all aspects of society. It is our collective determination to confront problems, our capacity to innovate, and our willingness to care for one another that makes the difference in the end, including in the fight against a deadly virus. These efforts and the work of organizations like INGSA must continue. So, in an age of instant communication and unbridled information sources, I hope that this meeting allows you to reaffirm your connections with your peers, to exchange ideas, and to share valuable insights, and to keep a frank and rigorous dialogue open, making the best use of your knowledge and your expertise to inform the decision-making process. This planet needs you, needs your ability to network and your continued leadership so that we can continue to gain understanding of our world, so that we are better equipped to keep invisible and visible threats at bay, and so that we all contribute to pave a brighter future for everyone. Thank you for your dedication. Have a great forum. All the best. Stay safe.
This session is arguably one of the highlights of the INGSA Global Week of Dialogue of the relationship between science advice and the COVID-19 pandemic. And what we have here at this high-level panel is an opportunity for some of the world's most distinguished thinkers on the interface to reflect a little bit on what they think might be the lessons we can learn at the interface between science, evidence, policy, and politics, recognizing that we're still early in the evolution of the pandemic, and we'll have to be reflective over coming months as to what questions we should go back and ask, and look not just at ourselves, but also at the whole system to think about what we could do better. Because fundamentally, the world is facing a really significant existential crisis, and science and its relationship to policy is right in the center of focus of everybody in the world. So with us, we have Professor Pearl Dykstra, who's Deputy Chair of the Group of Chief Science Advisors to the European Commission and a member of the Governing Board of the International Science Council and a distinguished social scientist. Professor Prof Yik-Ying, who's Dean of the School of Public Health at the National University of Singapore. Professor Tolu Oni, who's a public health physician and epidemiologist from the University of Cape Town and the University of Cambridge. Professor Miguel Nicolelis, who's from the Duke School of Medicine and Neuroscience and has been heavily involved in scientific advice for Brazil's Northeastern states. And I'm Peter Gluckman. So before we go any further, Pearl, would you just like to give some initial thoughts?
Well, Peter, thanks for putting this panel together. These are very exciting times, and particularly for science advisors, but also for scientists and for policymakers. And I like the question that you're asking us, what might we be doing better? But let me first emphasize that I think actually the science policy interface has been doing quite well. The fact that scientists or advisors or both are being asked by governments for suggestions. And yes, we all know that at the start it was the epidemiologists and the virologists, but quite soon a broader range of scientists was called in, which I think is very encouraging. I'll leave it at that. I can talk for hours, but you asked me to kick off. I'll start with that.
So Professor Teo, your view from Singapore.
Thank you very much, Peter. Singapore, we had to pay us a very high price back in 2003 because of SARS. And back then, the government made a commitment that we will not be caught unaware again. And I think this is where quite a lot of the partnerships between the government, the clinical entities, the public health entities have actually paid off, because we've learned our lesson in the reliance on rapidly evolving science as what we see in the instance of COVID-19, that there has been rapidly evolving understanding of the way it is transmitted, of the way communities are at risk, and of course, the way that we can make use of data and evidence generated from academia, from the private industry, to facilitate a national response. So we have been fairly fortunate that we have public health institutions. We have a National Center for Infectious Disease specifically designated as pandemic control centers. And that has helped, because with the availability of science from modeling to look at whether school closures would be relevant or would be useful, closing workplaces, what are the policies around travel that we should put in place? Those have actually facilitated a lot of the national response. And I see that this has only been possible because of a very strong partnership between the policymakers, between scientists, between social scientists, and between clinicians. And those partnerships cannot be built during crisis moments. They have to be invested, they have to be built during peacetime. I will stop there, but I will be very happy to elaborate as well as to discuss this with fellow panelists. Back to you,
I might just make one comment there, and that is Singapore may be one of those countries in the world where the public belief and the political belief in the importance of science to national well-being, both economic and personal health, is particularly well advanced. That, you know, given that I guess your founder declared that the only asset that Singapore has was its brains and its human capital, it invested very heavily in R&D in a unique way. And
Yes,
that's probably paid off.
Yes.
Miguel, from Brazil, you're sitting in a very different situation, say, to myself in New Zealand. We probably could be more different in our country's responses to COVID.
Oh, absolutely, Peter. Thank you very much for the invitation. It's a great pleasure to be here talking to all you guys. Yeah, Brazil has a very peculiar situation because the federal government, on one hand, decided to basically ignore science and basically treat the pandemic as it was, just as our president said, a little cold. And that was a disaster. That was the recipe for a disaster that you all can see on the numbers. In the middle of this, the 9 governors of the Northeast region of Brazil, which basically is one of the poorest parts of the country with about 60 million people, decided to go on the opposite direction and created the first scientific committee, the first scientific task force of the country, which took the country by a shock, because as the federal government was saying that this is not a major problem, we should all go about our business and forget about it, the 9 governors of the Northeast said, no, this is a serious issue, and we need to create a high-level scientific commission. And I was, invited to direct this commission, this task force, and immediately we put together a group, a multidisciplinary group, with scientists from many different disciplines. And Brazil, as you probably know, has a very long tradition of excellence on infectious disease and tropical disease research. And Brazil responds for about 20% of the papers on tropical diseases around the world. But in fact, we recruited people from all over Brazil, and in 2 days created a virtual platform with 2,000 collaborators from Brazil and abroad, that basically became the leading network of scientists in Brazil to attack the problem. And the result can be seen in the statistics. The Northeast region, despite being the poorest part of Brazil, together with the North, the Amazon region, has the best indicators right now, the best epidemiological indicators, the lowest levels of death right now, and the lowest lethality level. I mean, I'm in São Paulo, the richest city in the country, the largest city in the Southern Hemisphere, my hometown, and São Paulo has one of the worst indices in the country right now, because here it took a long time for the governor and the officials to realize that science is needed. So that, I think, is my introduction.
Tolu, I've left you to last because you're sitting in a country which traditionally has been seen to have one of the most advanced science advisory mechanisms in the world. Yet things haven't gone so well in the United Kingdom. Your insights, both from there and also from the fact that Nigeria has done very well and South Africa is perhaps not doing so well, and you've got experiences in all those countries.
Thanks, Peter. This is such an important conversation. I want to say so much, and I'm going to think about how to structure my opening remarks. I think some of the things, the key things that I would love us to touch on at some point, and these are my reflections from both being here in the UK, but also my experiences in South Africa and being Nigerian. I think one is the importance of completing that the nodes between science and policy by adding that society component. Because actually when we talk about that interaction between science and policy, I think we've learned that it's impossible to do so without thinking about the ways that science engages with broader society and the ways that politics and politicians are perceived and received with the public. And these are not predetermined, none of those connections are predetermined, but certainly from the perspective of science and society in the middle of a pandemic and emergency, I agree with my colleague from Singapore. It's very difficult to build those kind of relationships from scratch without having the foundation being built over time outside of moments of crisis. That's the first thing. The second thing I've noticed is the importance of learning from others, from the experience of others, and adapting responses to the local context. Learning from others involves recognizing that, setting aside hubris, should we say, as we've seen it play out to the top countries in terms of if we had to look at preparedness and we had to rank emergency preparedness, it's not really panned out. That theory is not panned out in reality. And so it's important to not just, stay stuck on where we are prepared because the indices say we're prepared, but rather to take the opportunity to learn from others. And if we look at the countries that did well certainly at the start, both South Africa and Nigeria did well on that, in large part because we looked at what's happening elsewhere and said, well, what is working and how do we actually learn from that, and how do we adapt responses to local context. I think the adaptations came a bit later because obviously the public health tool we had for control is a very blunt one of movement restriction, shelter in place. And we've seen that this played out with very different and varying consequences across all three. So this is not just in South Africa or in Nigeria. And this leads to my third point of the importance of the understanding the underlying inequities. And this is something that has just come up so strongly. Even if we talk about the UK, and I say that from a perspective of how it relates to the science, the way that we apply the science in thinking about exposure, in thinking about vulnerability, but also in thinking about consequence of application of different interventions. And that really comes to maybe the point that you raised, Peter, around the plurality, and I would add to the plurality of advice, not just disciplines and not just experience, but diversity of experience and perspectives in that advice, because you could have people all pull together who might come from different disciplines but have the same Cambridge experience, and it is actually not representative of the country. And then maybe the last point to make this an opening is to provoke a little bit to think about the ethics of non-engagement as from a scientist's perspective. And that is me just being a little bit provocative, because in the context of something so novel and so uncertain, we've seen quite a lot of reticence. So we've seen some scientists obviously coming on board and taking up, as Pearl mentioned, the opportunity for that engagement. But we've seen a lot of reticence as well, because I'm not exactly nobody is a COVID expert. So I would love us to touch a little bit on the ethics of non-engagement in the context of such a widespread challenge with vast societal consequences.
Well, I would like to come to the ethical issues as a topic, because I think there's a broader range of ethical issues that have emerged. For example, I think there were scientists who were competing for access to power and using their pronouncements to reflect their wish to be involved in different ways, which was also problematic. But I think one of the issues that, if you think about the responses, there were countries such as Singapore, Korea, Taiwan, who were I guess, sensitized because of SARS and other infectious diseases. There were countries that, like New Zealand, Jamaica, some of the other island states, who quickly decided, for various reasons and various mechanisms, just to shut the borders and get control very early on. And then we had the bulk of countries, of which the European countries, the United States would be, particularly the European countries, Pearl, tended to allow the pandemic to grow quite a long way before any severe constraints were put on. It was observed in various countries to quite a way, whereas countries like Jamaica, New Zealand had shut down when there was only a few hundred cases, not even that many in play, even less. So that raises the big issue of, did it matter whether there were pre-existing mechanisms of advice in existence, or was it that countries could manage to develop mechanisms that were effective early on? And even in some cases, Tolu, where the pre-existing mechanisms existed, it doesn't appear that they were able to create an urgent response, whether it was for scientific reasons or whether it was for political reasons or a mixture of both. And I just wonder whether we shouldn't focus for a moment on this business of who was giving advice, what range of advice was needed, and whether the existence of pre-existing mechanisms made it easier for that advice to be heard. Pearl, as you sit on one of the most important science advisory mechanisms in the world, do you want to comment? I know that in Europe it's largely the member states responsible for health, not the Commission. But from your perspective, what do you think are the comments you'd like to make?
You're touching on a very complex issue, and that's also my position here. I reside in the Netherlands, so I know very well what has been happening in the Netherlands. But I'm one of the chief science advisors for the European Commission. The European Commission has an awful lot of science advice mechanisms. And what happened at the start of the pandemic is that it was the emergency advice that was called in, existing mechanisms. But we were also in Europe stuck between the mandate of the European Commission, but also the member states. And Peter, you're perfectly right at saying that health is very much a national member states. And it's fascinating to see the wide variation in Europe. Look at the differences between developments in Italy and Spain, for example, now that we're easing out of the lockdown, where, and we don't know the answers, Spain is having a much steeper rise in new cases than Italy has. But how different are the countries? Look at the difference in the kinds of measures that were taken between Sweden and Norway. Norway had a very strict lockdown. Sweden, they're neighboring countries, felt there should be more autonomy for its citizens. Citizens should have greater abilities to adapt their own responsibility. And this is all has to do with the traditions of the countries. Now we go to the European Commission. What happened quite soon is that the Commission realized that it had to step in, particularly at the height when all the cases, when the hospitals were piling up, when it was clear that there were too many cases in the intensive care units. And that's where the Commission said, hey, we actually need something new. And that is when Peter Piot, well known for his background as an AIDS researcher, well known in fighting Ebola, was called in. And so a new mechanism focusing specifically on the pandemic was introduced in Europe. So it's a mix of what's there. Also, the pandemic was so difficult to manage. There was a lack of knowledge. So I'm not sure a pre-existing mechanism is a guarantee that things will go well in a specific country.
Tolu, do you want to follow that up thing at all?
Yes, I think the other, I fully agree. And I would add to that, that the other aspect is what we've seen is that not only is that not a guarantee, but also the terms of reference of those existing mechanisms that may have worked and have been acceptable or accepted in previous emergencies or convened for different reasons seem to have fallen short this time. So, you know, example in the UK, where the scientific advisory group on emergencies, you know, those terms of reference had been in place, but for this particular pandemic, the insufficient transparency on who was on the committee became an issue. That wasn't a new phenomenon, that was always in place, but for this, because of just how much it permeated all of society, and I don't think that was necessarily foreseen, that, you know, the need for transparency and more clarity on the nature of the science that's being communicated and that's being advised, on who they were, because there's so much tension. It was needed for trust, because suddenly it became an issue the trust became an issue in the context of an opaque science advice system, or perceived to be opaque, and that has spawned a parallel, not related to the government, but a parallel independent SAGE, for example, that comprised of either former scientific advisors or people who were on SAGE but did not feel that it was sufficient to realize that, okay, there is clearly a need for a call for people to hear what advice would be given to the government, irrespective of politics, but also to engage with the public directly in a way that perhaps the official structures were limited in. So I think it's another plurality, right, of not just the expertise within the official structures, but of a challenge of this nature, realizing the plurality of mechanisms was perhaps something that was, I think important.
Professor Teo?
So I wanted to follow on from both what Pearl and Tolu mentioned, because I think it's important to highlight that it is not just member states in regional blocks, be it European Union, be it in ASEAN or the African Union. Because when we start to look at some of these responses, there is the country level response. But in many countries, particularly geographically diverse countries, such as the United States, such as India, such as the Philippines, policies, actions, the actual implementations actually happens at the state or provincial level rather than at the federal level. And that really highlights that when we start talking about these interactions and communication, who is making the decision, who is speaking to whom, we have to take into account of the specific cultural and country context. Because if we have a federal decision that is made in a country like India, certain states will have the means to execute it and implement it very well, such as Kerala, but there will be other states that may not. And I think this is the context that really matters when we start to deal with a global outbreak such as the COVID-19. So that's the first point. The second point that's touching a little bit on what Peter, you mentioned, and Tolu, in your opening, you mentioned as well. We have all these global health experts, these public health experts. They are in Europe, they're in North America. And rather strikingly, if we look at the Global Health Security Index, at the very top, we have the United States. At the second place, we have the United Kingdom. And I think this really highlights the need where the measure of pandemic preparedness goes beyond just paper documentation, but really looking at some of the outcomes that matter. And it's just very striking that the world looks to North America and Europe for advice on pandemic preparedness. But when an actual pandemic of this scale happened, it's rather striking in terms of the response, in terms of the outcomes. So just some comments I wanted to follow on.
I think if I could just comment there, Professor Teo, I think it's an even deeper issue because we actually have just published a paper, or it's in preprint form, out there on the index and its misuse, because I think it gave some countries a false sense of security when the index itself is such an artificial concept and not actually getting at the real needs of a country to prepare, that it was very problematic. Miguel, do you want to comment, given that you're in a country where you've had to use a bottom-up approach to, at least in the Northeast, to make progress?
Sure. I was about to say that I have a foot in two countries, US and Brazil. I have been living in the US for 32 years, and both of them took the wrong side. And Americans were very shocked by the lack of, preparedness for the pandemic. I mean, my friends in the United States, even though I have told them for years that the lack of a national health system, a public national health system, one day would get America in trouble, it finally came. And this was a shock, I can tell you, even to the academic community. And in Brazil, what became clear is something that Tolu just mentioned. This is not a typical scientific committee. This should not be like the typical thing that we all do for a living. This was a task force. I had to convince my friends, Brazilian scientists in the first meeting, we were not there to make, infinite discussions about the biology of the virus. We're there to try to save lives, as many as we can, as fast as we could. And we should think completely different. And to give an idea, one of the issues that made this committee very popular around the country was the fact that we had more than 100 volunteer communication professionals and artists, graphic artists, digital artists, that create campaigns on the social media. And actually, the first decision we took was to get a phone app in which people could report their symptoms, because Brazil didn't have enough tests. So we realized in the first moment, we would not be able to test, not even close to the 200 million people down here. So we basically got a phone app connected to a situation room and created what we call emergency health brigades that went, to house in the countryside of the Northeast, and got a feedback from these brigades back to the situation room. So we create a loop to monitor the situation going on in real time. And we immediately create a channel to get this data, not only to the governors and the mayors, but also to the public. So we could tell what was going on, and the public knew what was going on. And the transparency issue was fundamental, because out of sudden, this little app that was developed, in a university in the Northeast was being downloaded by 200,000 people. And we got 150,000 telemedicine appointments and got people to hospitals and to the best places to go. So it was nothing like what I do for a living as a neuroscientist in terms of handling a scientific committee. And in the land of football and samba, suddenly people are discussing on TV statistics and epidemiological indices because they knew what they were about. They were seeing in real time what incidence, prevalence, all these strange words that we use mean in practice. And that made the difference, in my opinion.
Well, I think if I just make a comment from a New Zealand point of view, I think one of the most important things you've highlighted there is the importance of communication. And I think good communication to the public, of which, I think our government did very well, was very important. On the other hand, I think what is also very important, you've mentioned and Tolu's inferred, is the importance of transparency. And I think there is a concern, even in some countries that have done very well, of a lack of transparency on aspects of the data that really matter. So I think this issue that I think when we come to be reflective at the right time in the evolution of this pandemic, the issues of transparency of these committees is clearly was an issue in some countries, but it may be an issue in all countries. if we're going to have public cooperation over a long time, because in the end of the day, with an infectious disease, it's behaviour of the public that actually ultimately determines success or failure, not the cleverness of the clinician. And so I think there's a lot to learn here about sharing with the public what we really know, rather than politicians and advisory committees keeping it tight. I see a lot of nodding heads.
Can I build on that? And maybe this is a provocation for science, thinking about science advised mechanisms. So just building on what you just said and what was Prof Teo mentioned earlier about the importance of the local. So we know that, and this is the case across the board, the on-the-ground implementation happens at the local level. So whether that's a local authority or a state or a council of some sort. So perhaps we need to ask ourselves how much of the, in participating and engaging in science advice at the national level, firstly, at that national level, how much of that is cognizant of the heterogeneity of the country? Because that was, I think, an important aspect, certainly in the UK, in thinking about, well, what would the implications be? What are the realities on the ground? And that has to be factored in when you think about advice that is then recommended nationally. But if we go sub-nationally, should we not be thinking about localized science advice structures that then take that national level and say, you have a country like the UK, we have a lot of global health, public health professionals, practitioners, specialists. Should we not be having little nodes where at the local level or regional level, you have the government representatives, the policymakers, then convening many science advisory structures that then take into consideration the very local levels? Because I think the top down can only be so sensitive for or contextual for all parts of the country. Will normalize towards London, say, in the UK. So should we have had a city level or council level hub that then says, okay, building on this advice from national, how do we think about, what do we know about the local epidemiology of our context? Does that attenuate the advice in any way whatsoever? And what implications will that have on our local population?
Will it not depend, Tolu, on what level of advice you're talking about? Because I think what we've seen in some countries is where advice has been contested between scientists and the public domain, it's been an excuse for politicians to pick and choose or to do nothing. And so there is a danger that if there is conflicting advice, the public's confused, but the politicians will pick and choose what is politically convenient or be paralysed by the indecision of different advice. And I think we've seen that in some countries.
Right.
And I think if I just think about the contestation over epidemiological models that have gone on in some countries, that's played into some of these issues. So, I just wonder the extent to which there are ethical issues about how scientists conduct themselves in public that we haven't yet fully explored and need to be explored in emergencies, because I think the more contested, the more confused it is for both the ultimate decision makers and for the public. And I don't think we've explored the issue of science, of ethics of science advice, both the formal advice going through whatever mechanisms get set up, but also the conduct of the scientists who perhaps are not in the system, but are still making a lot of noise. I don't know whether it's certainly an area which the National Science Council and INGSA are thinking about and have a committee under Professor Robin Grimes exploring at the present time.
Can I jump in here, Peter? Communication is crucial. Tula mentions the local aspect, I would like to mention the temporal aspect. At the beginning, it was lockdown, distancing, the message was clear. And nobody knew how long it would last. So yes, communication's essential, but I think we also have to take changing circumstances into account. You talk about the scientists, the ethics of the scientists. You also talked about certain scientists wanting to be close to power. I think that we have to look at ourselves, and we, in this case, is the scientists and the science advisors, or let's call them academics. And we have all been trained to outsmart each other. That's part of our training. It's how we write grant proposals. It's how we publish. It's always because we can do it so much better than our predecessors. And what's needed here, and it became very evident, is that we build upon each other, or that we're very clear about why is there a difference of opinion? Is it a difference of opinion? Is it the data? Is it the method? Is it my methodological training? But we have to learn, and we have to do it more often, is to explain why is there a lack of consensus. Because I do think the fact that there's no consensus can be good, even for policy advice. Because don't forget that a lack of consensus might also be a sign of something that has yet to emerge, that someone in a very, just an outside corner might pick up something that turns out to be very crucial. So yes, transparency on why certain decisions are made, transparency about why there is disagreement. But I would also say, instead of us trying to smooth it all over, we also have to pay attention to possible dissenting views, which might have very important policy implications. And we have examples.
I don't deny that, but on the other hand, governments have to make decisions. And yes. I think within all of this, and the lessons that have come out of the countries that have done well is fast decisions are important, and delayed decisions have cost lots of lives. And so that's the dilemma in this. Miguel.
Yeah, no, I just want to complement what Pearl said, because I think there's a very important thing that we are perhaps putting under the rug, and we should bring it out, is the fact that the pandemic exposed a lot of fragilities, a lot of weaknesses in the development and growth model that we decided to do or to opt globally since the Industrial Revolution, okay? The pandemic just exposed all these fragilities in a very, very clear way. But it also exposed the weaknesses and the fragilities of the science mode that we decided to do in the last 50, 100 years. This highly competitive, money-oriented, grant-oriented, this was completely destroyed, in my humble view, by the need to collaborate fully, to share data immediately, to actually get studies with 80, 100 people participating, with much less egos involved and much more collaboration. Science has to go to the divan. It has to find a psychoanalyst, I guess, and sit down and reflect about our way of doing business, particularly in the United States, that exported this model to the entire world. Because you cannot, in the United States at least, talk about science when you meet someone and you go to give a talk in university. The first sentence is, I'm writing a grant. I'm writing this proposal. And this is actually what is the problem. Because down here, when we got together with this bunch of very famous scientists, Brazilian scientists, some of them working, abroad in very famous universities, the first thing I said was, guys, we are not writing grant proposals and we are not competing. We are trying to get, as you said, Peter, a very quick decision about a lot of things we don't know anything about it. And that's what we are here for. And forget about, I'm smarter than the next guy sitting next to me, because that is not going to help.
And that raises the next question, which is, we've talked about communication, but within all of this, we've also had to communicate uncertainty, because we've been dealing with a lot of unknowns right from the outset. And I think there's a lot to learn and to think about the communication of uncertainty in situations where decisions have to be made and can't be left. And I don't know whether any of you want to comment on that, but I think that sometimes we've seen too much faith in a single number, you know, the R0 being 2.5 or whatever, which is actually meaningless in the context of a complex society with different organizations and different behaviors. You've got to come to a very different way of thinking about it. And I don't know whether Professor Teo in Singapore, there's been much thinking about this issue of communicating uncertainty.
So it's a very good point you brought up, but I will share with you what we in academia within this part of the world thinks, because I think we clearly see that the ability for the public and even the policymaker to be communicating and to accept the uncertainty has a lot to do with the trust between the people and the government as well, the policymakers. Because if the trust is there, this is really where the government can come forward and outright admit, we don't actually know what's happening here. It is a very new pathogen that we're dealing with. We have to learn along the way. There will be mistakes that we make. Bear with us. But if the trust is not there, a government saying that immediately subjects itself to an entire amount of criticism. And that's why when I think about communication, the way that we communicate, the message that we send, a lot has to do with what is the inherent level of trust between the people and the policymakers. So just a thought I wanted to follow on.
Well, no, I think it's a very important thought, Professor Teo. And just as an aside, there's a very interesting paper, I think out of Oxford, pointing out that across a large survey in the Great Britain, the trust in government was inversely related to the compliance with social distancing requirements and with the belief in conspiracy theory. So that there's a whole, I think there's a whole sociological investigation, which is actually very important, that will require, I'm sure, people like Pearl and others to think a lot about the kinds of questions that should be asked in the aftermath of all of this, particularly given that misinformation is playing quite a large role in how some countries, and I'm looking at you, Miguel, might be playing in how the pandemic is being managed.
Yeah, basically, since we had a president that denied and continues to deny the relevance and the lethality of this pandemic, that's where our communication team was so fundamental. We created a campaign, for instance, that said fake news kills, you know, and this was all over the country. Suddenly, even though we're dealing with the Northeast region, this campaign went all over. And basically, we created the notion that every sentence, every incorrect information that is delivered through social media could kill people for a variety of reasons. And we had also to deal, and this was the most difficult, we should believe it or not, with the president of the country following the president of the United States and trying to promote a drug that has no effect whatsoever in any phase of the infection. And this was relentless. He was on TV every day showing the little drug, and he claimed that he got sick. We don't even know if it's true. He claimed that he was positive for COVID, and suddenly he was telling how much of that drug he was taking, what time of the day. He was even going to the presidential palace, around the beautiful area around the presidential palace, talking to the, showing to the animals that live there, the wild animals that live there, that are the proud of Brazil, and showing the drug to these poor birds. And, and we couldn't believe in that. So we had to counter a tremendous fake news campaign coming from the very top of the hierarchy, of the political hierarchy. and it was not easy. And we created another sentence that became very popular here. There was politicians take on biology wins by a long margin. And that became very popular because, you know, it associates to images of football the Brazilians actually love to talk about. And suddenly, a lot of scientists were called to go on TV, something is very rare here in Brazil, to talk about the crazy attitude of the president of the country. And it seems to have worked and helped.
Let me just switch topics a little bit. We focused largely on the beginning of the pandemic, the decisions to lock down, to take social constraints. We're now seeing countries taking different strategies about exiting out of levels of constraint, discussions of second waves and so forth. Some countries are moving very early, even before the pandemic has even peaked, out of constraints. We've also seen a lot of discussion about new technologies, new methods of testing, new contact tracing techniques, apps, issues that arise around that. I wonder to what extent science is going to continue to be used as this pandemic proceeds. You know, has science advice going to continue to be maintained by governments as an important part of the process of exiting the pandemic, involving these new technologies that may allow the world to progress, even not discussing the components around vaccines? Or are countries going to pull back from seeing science having done its job? I hope not, but I do worry that science could be put into conflict with economics as this thing progresses. Tolu?
I mean, I think there's always a tension, but I wouldn't call it a conflict, because I think it's been part of the narrative that has been, I think, detrimental here is, oh, do we prioritize public health or do we prioritize the economy? That is such a false dichotomy.
Absolutely.
Because, you know, what is this economy that we speak of, if not people? I think it would depend on. There's three things I can think about. One is what I mentioned at the start around learning from the experience of others, and so bringing in the collaborative science, not just locally in terms of collaborating, but reaching out and collaborating, and for that to happen, we have to set aside this, or recognize first, but then set aside our biases around who we can learn from. You know, and so there are certain countries where expertise lies, and there are certain countries that are to be helped. And I think that really limits the mindset of, oh, should we look at what is happening in Brazil over here, or are they not on our list of countries that we can learn from? You know, I think that mentality and that mindset needs to be set asunder, as it were. The second is building on existing structures and in order to combat those deficits. So we see here, you know, obviously it's a new challenge. We need to evolve new technologies, but then are we asking ourselves also why? Is that drive in science still being driven by the ego and by the discovery, or is it and away from the less sexy, okay, this thing actually already exists and it's been used in contact tracing for many years for other diseases? Can we think about innovation in a way that adapts rather than just a shiny new toy? Because there's also that mindset of scientific and innovation advances where, you know, it's not an important discovery if it's not a completely new thing. Heavens forbid you build on what exists. And so I think that's another mindset. And I think the third thing, just built on the previous conversation on the fact that engaging and the role the scientists would play in the kind of long tail of this epidemic is to some extent influenced by us and the ways that we engage and the skill sets that that our scientists have to engage in that way. So I think, and it's not too late for this, there is an important role for academic institutions to reflect on what role they have to play in this, and how to pull in the power and harness the power within the academic institutions. And it's not just that we have the top modeler and then we've sent them and we've done our role, you know. So, you know, how we actually, if this goes on for another 2 years and we're actually going to need a lot more scientist engagement, bearing in mind burnout, because that's something that we haven't talked about. You know, we might need to replace, it's not the same people that are going to be on the front line of the scientific advice for the entire period. What can we do to build that capacity now, so that in a year and a half, we have people who are a bit more skilled and are more comfortable to engage in that way? So I think we need to be proactive in that sense.
I also want to turn to Pearl here, because I suspect that many of those scientists that we now need are not modelers, they're not epidemiologists, they're going to be sociologists, they're going to be psychologists, they're going to be economists as scientists, a whole raft of social scientists who really have a major role to play, I think, as the world moves from this acute phase into a phase of a significant reset in the way the world works, which this pandemic is creating. And Pearl, I don't know if you want to pick up on that.
I've been wanting to jump in. I don't want to interrupt. I was
just setting you up.
Thank you. No, and I was just amazed by what Peter said, is that science would become less important. I think one thing is, it's that terrible word science. Exactly. Where we think of people in lab coats. And so I try and use the word researcher or academics or scholars. I would say we need scholars, academics more than ever.
Exactly.
We also need the technical people, because they will be developing all kinds of, you know, what can we do with distancing and testing? And I mean, we'll need people like that. But we also, particularly now where we see in a wide range of countries that there's some opposition to lockdown measures or opposition to testing, possible opposition to vaccinations, that is where we need the social scientists and people from humanities to step in and to try and make sense of that and to provide options to the policymakers. So I would say it's more crucial than ever, because we're stuck with new dilemmas. And these are dilemmas that have to do with people's everyday lives, their everyday behavior. And we're seeing that people are not keen on, not all are keen on following the measures, or are frightened to go back to work because they have to get onto public transport. And then we get into the whole issue of masks, and do masks protect us, or do masks enable us or remind us that there's something going on and we have to maintain a distance? And these are the kinds of issues that social scientists can best address.
I think that's where Tolu's point about the need for those mechanisms of access to government and advice have to evolve from being very epidemiologically focused into a broader range of contexts. And I think that it comes back to the initial point, I guess, where this discussion started, the importance of plurality of inputs across not just the hard modeling epidemiological sciences, but also the social sciences, the psychological sciences, a broad range of different skills, the political scientists, because I think there have been a set of political issues here which have affected the responses, which we need to also understand. I don't know, Professor Teo, if you want to comment on the broader range of disciplines.
Can I just make
a comment,
Miguel? Because it goes exactly where Pierre just mentioned, and Tolula also. Since the beginning here, since March, we created among the subcommittees of our committee, one committee on social sciences, human rights, economy, and sociology of the pandemic. And we had about 200 scholars collaborating, producing documents and positions, because, as you probably know, a lot of issues that are not debated regularly, like domestic violence that is spiked here in Brazil, child abuse, which is spiked here also, and all sorts of economic problems created by the lack of financial support from the federal government to Brazilians. Those were all debated in parallel with the epidemiologists, the modelers, the traditional folks. And the impact of that subcommittee on our work has been tremendous. You know, he highlighted, for instance, one of the documents on nutrition, child nutrition during the pandemic was the highlight of one of our reports around the country, because it showed the problems the mothers were facing, not going to work, not being able to work, not having childcare for their kids, and not having financial support from the federal government. What was the impact on children from many dimensions? And I think, Peter, that goes to your point, that we cannot just rely on committees that are focused just on the epidemiology and virology or the central issues that people debate in science, but there are many other aspects of this problem.
Well, as a pediatrician, I have to comment that one of the things that we've highlighted in New Zealand is the impact on children at school. You know, the homeschooling and the digital divide. I mean, in our Indigenous people, up to 50% of the children did not have adequate access to digital devices for homeschooling, and that's in an advanced country. You know, the issues that for those, particularly the children in the latter school years, of not having access to adequate digital devices during lockdown has been very severe indeed. And we've just released a report on youth mental health in relationship to this. So I think there are broader issues that governments need to be thinking about, and the science community and the academic community have an absolute responsibility to be thinking about and finding ways through whatever mechanisms are the appropriate mechanisms and contexts to bring these forward. Professor Teo?
So I wanted to also raise the point that when we talk about social science, it extends beyond behavioral scientists, social scientists, sociologists, but also to include legal science as well.
Mm-hmm.
Yes.
Because I think we are starting to see that there is a degree of evaluation that needs to happen to see what are the powers that the state or even employers have during times of an outbreak such as this to enforce certain measures on the people as well as on the workforce. Because imagine that I'm the president of a university and I enforce that everyone, whether you are a student, you are a faculty staff, you are an administrative staff, or you could be an auxiliary staff, like people who work in the canteen, the cleaners, everyone that enters the university must download one of this contact tracing app. And you could immediately see that there could be gray zones that one encroaches into. So I think the legal science community has to be part of the conversation as well, because when we start to look at some of the rules, and in fact, I've always made this point that for the territories, the countries that seem to have done a great job keeping the pandemic in check has been those countries that have not been shy to enforce certain penalties, warnings, if people break the rules around mask wearing, social distancing, coming together. And I think that this particular aspect need to be addressed very clearly as well. And I think I will also follow on the point about earlier on, Pearl talked about the importance of social scientists, behavioral scientists, economists. Peter, you raised the point about economists. And I think this is exactly the approach that needs to be taken, especially when we start to look at the vulnerable and the neglected sectors of the community. In Singapore, one of our tough touch point, the difficult crisis to resolve has to do with the migrant workers in the dormitory. And in many instances, we realize that it is not just about the science, the hard science of virology testing, sewage testing, making sure that people keep to a certain distance. It is a lot about their behavior that they adopt because of culture, because of being away from home, and the friends around you are the only people that you have. And people do come together, they mingle, they socialize. That is what this is what being a human means. But exactly during a time of a crisis like COVID-19, so some of those socializing behaviors are the ones that we need to educate and to communicate very clearly and frankly to migrant workers, to vulnerable sectors, and in fact, actually to the whole community, that certain behavior will not be allowed because it puts everyone else at risk. And I see this to be very much the role that academia as a whole can play.
We need to start winding up in a minute or so. So I'm going to ask everybody two questions.
Okay.
One is, what would you like to say, what you haven't had a chance to say? And secondly, what do you think is the most important issue that we need to reflect on as leaders in the science advice community? Looking back, what should we be most reflective on as we look back over this first 6 months of the pandemic? Tolu, do you want to start?
Yes, thanks. I'll start by just building on what Prof Teo just mentioned in terms of last thing I want to say, is to extend the timelines a little bit, because we're talking about the period of the pandemic beyond the acute. I want to extend it even further in order to demonstrate the role of that science advice would continue to play, and that is into thinking about a more systems approach to vulnerability and resilience. Because what we're having here at the moment, so the example is given in the context of the migrants, say in Singapore, and I'm not familiar with that context, but in addressing the acute situation, in what ways could other policies help to reduce the vulnerability down the line? Because we have to see science advice as not just reacting to the current situation, but reducing the risk of a preventable emergency and mitigating the impact if not preventable. So in what ways? So a very clear example here is that, we've in the UK the government is talking about drive to reduce obesity, because we know obesity is associated with increased risk of severe disease and mortality, and that's great, and that's thinking about the next step. But on the other hand, we're not having that conversation when we're talking about building. So we're talking about reviving the economy and building in a way that bypasses the normal process of having to address the needs and community engagement in that way. So are we not setting up our environments in ways that people may not be able to be physically active, that may expose people to more air pollution and risk? So there's just such a role of science in thinking beyond just a reaction to thinking long term, to say it makes more sense, and in what ways can we inform what happens now as a way of thinking about, if we're framing it around the pandemic, prevention and reducing the costs down the line. So that was, I think, a really important point that I wanted to mention, because we're not always just reacting in terms of science advice, but there's a proactive aspect that science and evidence, academia and scholarly input could bring. And then I think my parting point to your second question, Peter, I think is the importance of the next generation of scientists. So if we're talking about science advice and we're talking about this plurality, we're talking about this evolution, recognizing all these different, in what ways are scientific and academic structures aligned to train people with those skill sets and those priorities and those responsibilities to build that next cohort? And so we have to be thinking long term, and I think that is on the academics, all the academic governance structures, from the universities to the funding to the training, to think how do we ensure this is a core part of being a scholar, core part of being an academic? You cannot become a top academic if you have no societal credibility.
I agree with that fully. Miguel, would you like to reflect at the end?
Sure. Well, I think now I can use what I learned as a neuroscientist to make this final comment, because I think neuroscience explains a lot of what brought us here. One of the greatest attributes of the Homo sapiens brain is its ability to generate amazing abstractions. And unfortunately, these mental abstractions, one of them is science that we're debating here, but everything that we do comes from here. And unfortunately, some of these mental abstractions have become more important than life itself. Economic dogma, political systems, ideologies, they have become abstractions that are putting us in danger. And in fact, they're putting the planet in danger. Because if we keep using abstractions like infinite growth, something that cannot be supported in a planet with finite resources, we are going to go and disappear like many other species before us, despite the fact that we can think these beautiful things and create these mental descriptions of the universe that no other species that we know so far is capable of doing. So as a neuroscientist, what I want to see is in the future that we realize that we cannot keep going that way. We cannot keep producing abstractions that will kill us eventually. Basically, there is no such a thing as infinite growth. There is no such a thing as no funding for public health globally. There's no such a thing as continuous collaboration across the planet, some sort of mechanism that we could be using to prevent further pandemias to come. And I should say that the pandemia, the coronavirus pandemia, is not an extinction event. We know that by now. However, there are very simple things that could happen, like a solar flare, that could basically destroy our society by burning all the little tiny wonderful gizmos that we love to use. And that in about 8 minutes, internet is gone, cell phones are gone, electronics are gone, electrical society is gone. And what happens to us? We haven't been thinking about these issues. And I think as a neuroscientist, I would love to see a future in which mental abstractions are put back to where they belong, below the hierarchy of living, below the hierarchy of human happiness and humanity development. The human condition cannot be subserving economic ideas or political ideologies that go against the future of the species.
Professor Teo?
So, Peter, you asked for two things. I think the first would be really at the end of the day, policies don't count for much if the people don't actually listen and comply and believe in it to the extent that they will actually practice. So that's the first point. The second point is, as you mentioned about leaders of science, I think we really have to reflect on our own role. I think the self-reflection, the introspection, the recognition that it is always easy to be the one criticizing the government. We have all this academic knowledge, we have all this evidence, and it's easy to be standing up in front, perhaps in front of the public, and be seen to be critical of the government. I actually think that that's the easy way out. The really hard part is how do we as academics work with a difficult government that may not always be listening, or they may not even be listening at all. And I think that is the hard part, that we have to take up this challenge. Because it sounds grand, but I genuinely do believe that our position as academics, particularly as leaders in our field, is unique and greatly privileged. It comes with an important responsibility. We really have to look at how we work with the policymakers. We have to convince them with the science, with the particular degree of advocacy, such that sensible policies do get formulated, as well as when policies are formulated, they are actionable and they're implemented in a way that truly matters. And I see that in academia, we have that responsibility work with the government on this. Thank you, Peter.
Thank you very much, Professor Teo. I think those are some very wise words. Pearl, do you want to, I'll give you as the social scientist amongst us, you've been hearing an enormous amount of comment here about humans' place in the world and academics' place in the world. Do you want to make some final remarks?
Thanks, Peter. I would also like to emphasize the opportunities that this whole crisis has given us scientists. It has given us an opportunity to talk about to engage across disciplinary borders. It has given us an opportunity to communicate our uncertainties to the public and to the policymakers. It has given us an opportunity to try and explain how we reach a certain advice. And that's something that we're not trained to do, as Tula says, but it has been an opportunity for us. So let's not just focus on all this negative, but also see that there's an opportunity for academics to really help the public. That's one point. And another point is, it's looking back. That's what you asked us to do. And I think there we should, and it'll take time, look at the root causes of the pandemic. It's the way we've lived. You can use the big words: globalization, mobility, incredible inequalities. At the start, there was this suggestion that COVID was the big equalizer. It isn't. It reinforces existing inequalities. And I think that's where we should also be focusing our efforts as scientists, but also as policymakers.
Well, look, thank you very much. I mean, quite clearly this pandemic has been the biggest demonstration of the importance of science to every person on the planet. It's also shown the complexities of the relationship between science, policy, politics, and the community at large. And I think that we do really see enormous opportunities for science here, but also enormous challenges. And I think all four of you in your final remarks have made some really profound and important comments, which I just wish we had another several hours to explore and extend. But I'd like to thank you on behalf of the International Network for Government Science Advice for your contributions this evening, today, and look forward to ongoing conversations, because I think this is such an important event in the history of how science works with society that we must keep this conversation going. Thank you very much.
Thank you.
Thanks, everyone.
Peter.